All right, this is going to be the video demonstration portion of our phase 1 rehab running progression drills. So an important thing to know is if you're a patient of mine or an athlete that's watching this video that we're kind of doing your rehab process, just know there's going to be specific things denoted in your program in terms of, hey, I want you to do these drills only, not these ones. So and different yardage and stuff like that. So if that is applicable to you in this case, just make sure you're looking at your program. But really, more than anything, this is going to be a series of drills that we are going to use. We might not do them all at once. We might do them over a period of a week, 2 weeks, depending on the injury, like if it's a post-op situation. But we're just going to kind of go right through this more than anything. So first thing up is going to be ankling. Now, ankling gets confused sometimes for just a really bad high knee, and it's not a high knee drill at all. With ankling, we're trying to essentially teach the foot and ankle complex how to essentially to land and then create that force off the ground from just from that kind of stretch response more than anything. I really like to do this a lot early on in hamstring rehab because you should not get much hamstring involvement. So with ankling, we are not coming up to this position here. It is a minimal hip flexion, so minimal hip height and minimal knee flexion. And the other important thing is for your foot and ankle, you want to keep that foot and ankle in this dorsiflex, toes up position the entire time, and you're striking, kind of landing at the balls of your feet. Nice and easy arm swing. So what it looks like in place is I'm really just here, and again, I'm keeping those toes pulled up, dorsiflex like that, and then I'm coming down. Another good way to think about it is I almost want you to think about you have like water up to your ankle height. So you want to think about you're kind of just pulling your feet just enough out of the water, nice and easy like that. So again, at ankle height, here's our ankling. You can then, as you get good at this, or we might write in your program, go to more mid-shin, so it's going to look a little bit more like this. Again, I'm still getting minimal hip height, minimal knee flexion, but we'll start in place, and then we're going to go forward. The biggest challenge for some guys is getting that fluidity down, so you want to do this in place. So again, what it looks like all together, you can kind of start in place, and then you're just moving forward. Again, keeping those toes pulled up. You're not, as you can see, what I'm not doing is I'm not on my toes like this, like a pogo. I'm keeping that dorsiflex position. I'm landing on the balls of my feet, creating that nice, smooth kind of propulsion off the ground. Okay, so that's ankling. Marching. So we're just going to start in place. So this is going to be a bit more of that kind of higher hip flex position. Now what I want you to think about is when you bring that other leg up, that leg that's on the ground, I want you to think about you're keeping a tall pelvis. So you're not here falling forward. You're in a firmly extended position, glutes engaged, quads squeezed. You're up here. You're striking right underneath you. So when you go to strike down, if you look at my feet here, when you go to strike down, you shouldn't be out in front here. You should be striking right at the level of your other foot. Striking right underneath the body, on the body. Go, go, go. So again, start in place, nice and easy, and then you just kind of go through kind of nice and smoothly going into that marching. Again, early on in like a hamstring rehab case, we're going to go very slow with this. We don't want them to be exposed just yet, depending on the grade of injury, to that very forceful kind of extension coming down to the ground, because it historically won't feel good for them. And then we go progress from there. We just pick up the pace a little bit. Again, we're still not putting max effort into the ground. We're just keeping a good tempo more than anything. That's our marching. Our next thing is going to be ankle pogos. So we'll probably start double-double. So it's going to be really, again, here. You're on your toes, hands on the hips, pulling up, pulling up, pulling up. Now what I want you to notice here is as I'm doing this, when I go in the air, I'm not in this toe down position. I want you to think about pulling those toes up. So again, I'm here, toes up, toes up, toes up, toes up, toes up. It's not just that kind of floppy foot landing there as you're going down, very similar to ankling. So that's our pogo. It's our double leg pogo. Then we'll go alternating double. So it's going to be 1, 2, 1, 2, 1, 2, 1, 2. Again, these are good for either hamstring rehabs or knee rehabs, because you're not going to get as much knee flexion more than anything. So that's that. Now we're going to go into our A skip portion. So I like to start with all these in place. So A skip, 1, 2. You're just kind of finding that good rhythm, getting the arms going, start in place, make sure you're striking underneath you, and then you move through in a forward position. So the biggest thing is when you're doing this, as you're going to that skip, I don't want you way back like here, okay? One other important thing, if in your program, I write down, I want you to do it with a dowel, what that means is you have a dowel straight overhead, arms are extended, and you're in this stacked position down like so. Ribs are down, you're not flared out here. That's trying to teach, for someone that maybe is an overstrider, kind of does this, you want to teach them how to strike right underneath them more than anything. So again, with the dowel, what it looks like, I'm over here, skip, skip. Obviously, it's going to be a little more challenging because you're taking the arms out of the equation, but it's going to teach you a little bit better mechanics more than anything. So that's with the dowel. Now, a switch is just a little bit more of an aggressive skip, but it's not, again, this is not a fully like high intent drill. So again, in place, it's going to be 1, 2, 1, 2. So it's a little bit quicker of a switch. You're getting a lot more of that striking down to the ground. So starting in place, then going forward, like so. Okay? So that's your switches. Now, a high knee. Everyone knows about a high knee. So what we're going to do here is you're really just kind of starting in place, getting the arms going. Knees are coming up, pulling the toes up, start in place, and then going. Again, same thing, making sure you're staying stacked over. You're not leaning back as you go in that position. That's your high knee. A butt kick. This one is always done wrong. So a butt kick, most people when they do it, they look like this. They're kind of falling forward, and they're just kind of flopping their heels up like that. We don't want that for a butt kick. For a butt kick, you want to create a figure 4 position. So you're standing on one leg here. You're pulling your heel towards your butt. Now, if you notice, I'm not getting as much hip flexion as I would in a high knee up here. So I'm getting a lot more of this here. We're just trying to grease that kind of position of how when you're running at high speeds, you kind of come to that heel up position, and then as you extend out. I'm not doing that at this point in rehab. That's where we're starting to prepare more than anything. So starting in place, just to get the feel for it if you need to, just pull the heel up. Pull the heel up. Again, my thigh is in front of me. It's not way back here. So in place, we're here, arms going, pull, 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 and then you go ahead in a forward movement. Okay, so that's your butt kick, excuse me. The last 3 here is going to be a little bit more of like the kind of prep for the next phase to a degree in a more controlled environment. So I like doing a lunge deceleration. So what you're going to do, you're going to be starting here. You're essentially just going to very easily kind of jog into a lunge, stick, knee bend into that hip, and then repeat. So again, if you need to just kind of start with like a walking into it first to get used to it, that's fine. Obviously, a little bit of a jog is going to be a little more dynamic. So again, what it looks like all together, here, here, stick. What I don't want is I don't want you going into that lunge decel and that back foot kind of dragging. It should be the minute you come down, boom, you're sticking in that position. So we're just getting used to a little bit more of an acceleration position more than anything. Now from a push to base. So a lot of people see this push to base drill, lateral push to base, and like, oh, it's just a lateral shuffle. It is not a lateral shuffle. A lateral shuffle is a continuous going this way. And at this point, we probably don't want to do that early on in rehab, depending on the injury. So push to base, you're going to be in your athletic position. You're going to be in that slight knee bend. Hips are back, and it's this back leg here. So in this case, my right leg, I'm push, stick, push, stick, push, stick. So you're pushing yourself to that base position. Okay? So again, go back the other way. Push, stick, push, stick, push, stick. So there's a brief pause in between each reps, and you want to think about it's that back leg, that's the driving leg. Now, one other thing we will do is some med ball hurdle walkovers or unders. So let's pretend I don't have them here. Pretend you have some high hurdles. So I like to tell them, if we don't have high hurdles here, I kind of like to tell guys, hey, listen, I want you to think about you have like hurdles, a couple hurdles in a row that are at about, maybe hip height, maybe a little bit more, but probably about hip height more than anything. Or probably more hip to mid trunk, depending on the level of difficulty for each individual. So what we want to do is I give them a light med ball. It's like a 4-pound med ball. And you can do these without a med ball at first if you feel like you need to. But we're essentially just telling, hey, I want you to think about you have a med ball. You're going underneath the hurdle, and then you're switching sides. So you have a med ball here. You're kind of still directed forward. It's not purely laterally directed forward. Coming down, under, and up. Under, and up. And we do that same thing going back. So the med ball just gives them a little extra stimulus more than anything. Now what I like to do after that is an overhead med ball hold with a hurdle, kind of like an over the hurdle type thing. So now you're off more to the side of the hurdle. And you can then go in the middle, but start off to the side. So pretend the hurdles are kind of on my right side, or to the right of me here, not in the middle. I have a med ball overhead. Again, the overhead position is going to really force that vertical posture, keeping the ribs down over a stacked pelvis without compensating. So I'm going to be here, up and over, up and over, up and over. Keep those arms locked. And then you're going to go reverse direction. So you're going to be here, up and over, up and over, up and over. Our last thing we're going to do is just a nice, easy back pedal. We're not doing a back pedal into a twist and a jog, nothing like that. you're just going to start in a bit of a high split. You're going to be here, get the arms going, and just nice and easy, just pushing back, and that's it. Again, we're not doing a forceful turnaround and jog, nothing like that. So those are our phase one drills. Again, we will do them at different points in, we might do them all at once at very low volume, or we kind of gradually introduce some of them at, again, varying volumes. Some may be higher than others more than anything. And as you can see, like I'm kind of a little bit out of breath after doing that. Obviously, I'm talking as I'm doing this, but the important thing to note is there is going to be an aerobic and conditioning aspect to these drills more than anything. So you want to make sure you give yourself enough recovery time. And if you are a patient, an athlete, or client of mine, just make sure you're following what I program specifically in terms of which drills I want you to do and for what specific yardage.